I'm Hazel Robbie, and I am currently pregnant with my third baby. I have had my other two babies here at St. Luke's Hospital, and I'm very excited to have my third one here as well.
So when you come in, you'll check in at the front desk and talk to our greeter. From that point, whether you were scheduled to come in or unscheduled, we will bring you into one of our triage rooms and a nurse will come see you at that point. When it's time that you will stay with us, that's when we will move down to one of our labor and delivery rooms where you will stay, labor, deliver, recover, and stay postpartum.
At St. Luke's, the room doesn't feel necessarily like a hospital. It feels more homey, so you have like your own little bed, you have a fridge, you can set the temperature however you want, you have your own personal bathroom, which is really nice.
So when you first come in for your labor and delivery stay, you'll come into one room. That is where you will labor, deliver, recover, and stay postpartum. So we just transform the room around you.
After we got to our room, we started the labor process. I was able to get my epidural within 10 minutes of asking for one, which was a big thing that I think a lot of people think about is, am I gonna be able to get the epidural?
When you come in for pain control options, you may decide that you don't want anything medication-wise for pain. So we have multiple options.
At St. Luke's, they definitely encourage skin-to-skin contact with mother, so right after birth, baby gets put right onto mom, which is awesome.
Then at about an hour of age, the postpartum nurse will come in and do baby's first head-to-toe assessment. So we have an obstetrician that's on call in-house 24/7. We have a pediatrician that's available and a neonatologist just on the second floor.
St. Luke's was one of the first hospitals in the nation with a family-centered care award nationally. Our main goal is to really make sure that parents feel comfortable with the care that their babies are getting. We're a level 3 neonatal intensive care unit by American Academy of Pediatric guidelines and also by the state guidelines. We can take care of babies that are of any gestation, 22, 23 weeks and up.
So I worked with Leanne with breastfeeding after I had my son, and she was incredible. She made sure that all my questions were answered. She set up my pump for me and made sure that I knew the best way to feed my baby, and I had all the resources that I needed.
One of us is here every day to help families meet their feeding goals, whether with pregnancy, delivery, postpartum, and beyond. Breastfeeding doesn't always go seamlessly. Sometimes they may need special equipment or special services, and we just really want to help them and get through their fears and establishing a great breastfeeding journey for them.
I love that St. Luke's has a room service option, so you can order at any time and you get up to 3 meals a day. And their menu is quite extensive. You can get anything from breakfast all day to burgers to flatbreads, anything like that. Lots of desserts, which is awesome. And I just love that you can order it at any time.
So I would say that the best thing about St. Luke's Women and Children's Center is that the environment that we have here, the staff are very welcoming. It's a safe place to be. Any needs that you have would be able to be met.
Based on my first experiences that I had here at St. Luke's Birth Care Center, I'm so excited to deliver my third baby here.